Reporters asked one question, not a complicated one, not something buried in legal jargon. A single, direct question put to a hospital system and a county prosecutor's office about a family that would go on to make national news. Did anyone report this? That's it. That's the whole question, and nobody would answer it. I want to start there today because I think this detail, small as it sounds, buried as it's been under everything louder around this case, might actually be the most important thread nobody's fully pulled on yet. Not the marriage certificate from 2008, not the truancy filings, not even what investigators found when they finally walked through that door on Omer Road in June. This, a reporter doing her job, asking a hospital a straightforward question about a family they treated 4 separate times and getting silence back. Let me back up and give you the full shape of this, because I think once you see all 4 pieces laid out together, not scattered across different articles, not buried in a paragraph you'd skim past, it starts to look less like an oversight and more like a pattern nobody wanted to name out loud. Elizabeth Siders gave birth to twins 4 times. I want to say that slowly because I think it's easy to read past a number like that without actually absorbing it. 4 separate pregnancies, each one producing twins. February of 2022, November of that same year, January of 2024, and January of 2025, the most recent birth investigators have on record before everything came apart in June of this year. That's not a detail I'm speculating about. That's from birth and death records reviewed directly by ABC6 Investigates, cross-referenced against vital statistics filed with the state of Ohio. 15 birth certificates, 2 death certificates, all listing Elizabeth Siders and Gary Siders Jr. as the parents. I want to focus on one of those 4 birth events specifically today, because I think it's the one that exposes something the others don't quite get at in the same way. November 20th, 2022, Riverside Methodist Hospital in Columbus. One of the largest hospital systems in the state of Ohio. Not a rural clinic, not an under-resourced regional facility, but a major metropolitan hospital with the kind of infrastructure, staffing, and institutional protocols you'd expect from a place delivering thousands of babies every year. Elizabeth gave birth to twin girls that day, Faith Lee Siders and Bailey Lee Siders. They were born conjoined, specifically what's called thoracopagus, joined at the chest, a condition where twins typically share a heart, and sometimes other organs as well. According to the American Heart Association's own published research, this is actually the most common form of conjoined twinning, though most common here still means exceptionally rare, occurring in roughly 1 out of every 200,000 live births, according to figures from the University of Maryland Medical Center. The girls were born at an estimated 24 weeks. That's extremely premature. For context, a full-term pregnancy runs to around 40 weeks, so 24 weeks is barely past the point where a baby has any statistical chance of survival outside the womb at all, even without the added complication of being conjoined. They lived for about an hour. Their death certificates list the cause as respiratory failure, connected to both the conjoined condition and the extreme prematurity. The manner of death is listed as natural. I want to be completely clear about that, because I know how a case like this pulls people toward darker conclusions, and I don't think that's warranted here specifically. Nothing in the public record suggests anything other than what the medical documentation says. 2 babies born far too early, with a condition that, according to the National Institutes of Health, carries what researchers describe as a genuinely dismal prognosis. For non-operable cases of this specific type, survival rates approach 0. Even in operable cases, when surgeons are able to attempt separation, the survival rate hovers around 50%. So this wasn't a case of neglect causing a death. This was, medically, close to the worst possible version of an already devastating diagnosis. I want to say that plainly because the point I'm building toward isn't about what killed Faith and Bailey. It's about what happened around their deaths. What should have happened according to the ordinary functioning of a major hospital system, and what, as far as anyone outside that hospital can currently confirm, apparently didn't. Here's what I mean by that. When a birth like this happens at a hospital the size of Riverside Methodist, it doesn't unfold the way an uncomplicated, healthy birth does. You don't just deliver, recover for a day or two, and go home with a new baby and a stack of paperwork about pediatrician appointments. A conjoined twin birth, especially one that ends in death within the hour, activates an entirely different set of institutional processes. Death certificates have to be prepared and filed. Hospital social workers, in cases involving infant loss, are typically involved in some capacity. Not necessarily because anyone suspects wrongdoing, but because grief support and the practical logistics of handling an infant death are part of what hospital social work departments exist to manage. There are protocols, there's documentation. There are, in most large hospital systems, multiple professionals who come into direct, sustained contact with the parents during a loss like this. Not for 5 minutes, but across the hours it takes to process a death, arrange next steps, and eventually discharge grieving parents back into whatever their lives look like outside those hospital walls. Elizabeth Siders and Gary Siders Jr. went through all of that at one of Ohio's largest hospitals in November of 2022. And then they left and went back to Vinton County, where investigators would eventually confirm 7 months later, in June of this year, 16 other children were living in conditions serious enough that several of them required hospitalization once they were finally found. So, here's the actual question, not a hypothetical one. A question that a real investigative journalist at a real news organization actually put directly to the hospital system and to the prosecutor handling this case. ABC6 Investigates asked OhioHealth directly whether its healthcare professionals had contacted Children's Services in connection with any of these deliveries, not just the conjoined twin birth in November of 2022. Any of the 4 birth events tied to this family that occurred within OhioHealth system. I want to read you their response as precisely as I can, because the specific wording matters here. OhioHealth representatives responded by email, stating that because of federal privacy laws, they weren't legally allowed to share private health information on any patient without that patient's consent. Now, I need to be fair about what that response actually is and isn't. That's not a confirmation that nothing was reported. It's also not a confirmation that something was. It's a citation of HIPAA, the federal law governing patient medical privacy, used here as a reason to decline answering the question at all. And, on its face, that's a legally defensible position. Hospitals genuinely are restricted in what patient information they can disclose publicly, even to journalists asking good faith questions about a case that's already made national headlines. But I think it's worth sitting with what that non-answer actually leaves behind, because reporters didn't just ask OhioHealth. They asked Athens County Children Services as well, a separate agency that would have been in a position to receive a report, if one was ever made, from a hospital in that region. Athens County Children Services also cited confidentiality when asked whether it had acted on any tips connected to this family. 2 separate institutions, 2 separate opportunities to say, clearly, either yes, standard protocols were followed and a report was made, or no report exists in our system. And in both cases, the actual answer given was neither of those things. It was a citation of privacy law, functioning as a wall between the public and any real understanding of what happened institutionally in the aftermath of that hospital birth. And then there's the third institution reporters approached. This one, I think, is the piece that actually changes the shape of this story. ABC6 Investigates asked Vinton County Prosecutor William Archer directly, on the record, in a formal interview setting, whether there had been any mandatory reporting connected to this family, specifically naming hospitals and medical officials. His response, quoted directly, "I can't address that, sorry." I keep coming back to that phrase. Not, "There was no reporting that we're aware of." Not, "That's under investigation and we can't discuss it yet." Not even a firm "no comment" in the way officials sometimes deploy that phrase to shut a line of questioning down entirely. "I can't address that," which, depending entirely on how you read it, could mean he genuinely doesn't know. Could mean there's an active investigative reason he's not able to discuss it publicly right now. Or could mean something else, that addressing it directly would require acknowledging something the office isn't ready, or perhaps isn't legally positioned, to confirm yet. I don't know which of those it is. I want to be honest about that, the same way I've tried to be honest about every uncertain detail in every video I've made about this case. What I can tell you is that when a county prosecutor, actively handling 16 felony child endangerment counts against 4 defendants, is asked a direct question about whether mandatory reporting occurred at any point in this family's extensive medical history, and the answer is, "I can't address that." That's not nothing. That's a prosecutor, under oath to no one in that moment, but still speaking on the public record, declining to close the loop on one of the most basic accountability questions this entire case raises. Because here's what makes this different from some of the other systemic failures I've walked through in previous coverage of this case. The school truancy filings. Those are about a family successfully evading a system that was actively trying to reach them. Truancy officers sent notices. Complaints were filed. The system worked procedurally right up until it hit a wall because the family couldn't be located to be served with paperwork. This is different. This isn't a story about a family successfully hiding from the healthcare system. Elizabeth Siders was inside that system, repeatedly, directly, under the direct, sustained, hands-on care of trained medical professionals, 4 separate times, across 3 years. There was no evading anything. She was there, in the hospital, interacting with doctors, nurses, and, in the specific case of the November 2022 birth, almost certainly, given the nature of an infant death at a hospital that size, some form of social work or grief support staff as well. The question isn't whether the system could find her. The system had her, repeatedly. The question is what the system did with that access, each of those 4 times, and whether anyone connected the dots between one birth and the next. Let me bring in one more detail that I think deserves real attention here, because it's easy to miss inside all these other numbers. According to records reviewed by ABC6, the same midwife delivered 6 of the 16 children eventually found in that house. Not 6 different providers across 6 different practices, scattered across a decade and a half of moving between counties. One person, present for 6 of these births. I want to be careful here, the same way I've tried to be careful throughout every piece of this case. I'm not accusing that midwife of anything. Midwives, particularly those working in home birth or smaller community practice settings, aren't always operating within the same institutional infrastructure as a major hospital system. The reporting protocols, the layers of staff, the built-in checkpoints. That's not a criticism of midwifery as a practice. It's simply a different care model with different structural touchpoints. But if the same individual provider was present for 6 births to the same young mother, across a period that reportedly included at least 2 births when Elizabeth was still legally a minor herself, that's a pattern that existed in one person's direct field of view, repeatedly, over years. Did that provider ever raise a concern? Was any concern ever escalated? As of everything currently public, we don't know. Nobody's answered that question either. Under Ohio law, and this part isn't ambiguous, isn't a matter of institutional discretion the way some of these other gaps have been. Health professionals are legally required to contact police or children's services if they suspect child abuse or neglect. That's not a suggestion. That's mandatory reporting law, and it applies specifically to exactly the kind of professionals who were in direct contact with Elizabeth Siders across these 4 birth events: doctors, nurses, and by extension, most licensed midwives operating within a regulated care framework. So we have a mandatory legal obligation on one side, and on the other side, we have 3 separate direct questions: to a major hospital system, to a county children's services agency, and to the prosecutor now handling the resulting criminal case, that were each met with some version of, "We can't tell you." I think it's worth pausing here and asking what those 3 non-answers actually add up to, because I don't think they add up to nothing, even though none of them, individually, confirms wrongdoing. If mandatory reporting had happened, if, at any point across those 4 hospital births, a doctor, nurse, social worker, or midwife had flagged concerns and a report had been filed with Children's Services, that's the kind of thing institutions are generally not shy about confirming, even in general terms, when a case has become this publicly significant. Yes, our protocols were followed is a sentence that protects an institution's reputation. It's the kind of statement a hospital system's communications department would typically be eager to make if it were true, and if privacy law allowed for even a general confirmation of process without disclosing specific patient details. The fact that OhioHealth reached instead for a blanket HIPAA citation, the fact that Athens County Children Services reached for confidentiality rather than a general statement about their intake process, the fact that the county's own prosecutor, mid-case, said he simply couldn't address it, none of that proves failure. But it doesn't sound like an institution confidently standing behind a system that worked, either. I want to widen the lens for a moment, because I think this hospital question connects to something larger about how this entire case unfolded, and it's a thread that ties directly back to what I covered in a previous piece about the truancy filings. 6 children, 0 days of school attendance for an entire academic year. A truancy case filed in Gallia County in October of 2021. Written notices sent to the parents beforehand, warning them of the legal consequences. And then, by January of 2022, just 3 months later, a second court filing stating plainly that Elizabeth Siders could not be located, and the case was terminated because the family's whereabouts were unknown to the court. Here's what I think is the actual through line connecting that truancy failure to this hospital failure, even though they're 2 completely different systems, staffed by completely different professionals, operating under completely different legal frameworks. In both cases, an institution had real, documented, direct contact with this family. In both cases, that contact generated exactly the kind of information that should have triggered further scrutiny. An entire academic year of 0 school attendance in one case, a pattern of repeated, closely spaced high-risk pregnancies to an increasingly young mother in the other. And in both cases, whatever happened next either failed to escalate or, in the hospital's case specifically, remains genuinely unknown to the public because the institutions involved have chosen not to say. The school system's failure, at least, is documented in black and white. Court filings, dates, exact language about notification and consequence and eventual dismissal. We can read exactly what went wrong there because it's part of the public court record. The hospital situation is different and in some ways more troubling, precisely because of that difference. We don't have court filings showing what happened. We have 3 institutions ask the same basic question by working journalists, and 3 variations of, "We're not going to tell you." I don't think that silence is necessarily sinister. I want to say that clearly because I think it's important not to overstate what we actually know. Privacy law exists for real reasons. HIPAA protects patients, including, in a strange but legally real sense, patients like Elizabeth Siders, who is now a criminal defendant in a case involving the very children whose births these privacy protections are shielding information about. That's an uncomfortable legal reality, but it is the actual mechanism at work here. The same law designed to protect vulnerable patients from having their medical information exposed without consent is also, in this specific case, functioning as a barrier between the public and an answer to a question that genuinely matters for understanding how this went on as long as it did. What I think this hospital thread ultimately demonstrates, maybe more clearly than any other single piece of this sprawling case, is how many separate, independent points of contact this family had with institutions capable of intervening, and how consistently those points of contact failed to connect into anything resembling a coordinated response. The school system flagged an academic year of complete absence and then lost the family before it could follow through. The hospital system, according to everything currently public, has not confirmed one way or the other whether it ever raised a similar flag. And the prosecutor, now responsible for building a criminal case against 4 adults, 16 felony counts each, says he simply can't address whether that hospital-level accountability question has an answer yet. 4 birth events, 1 hospital system, 1 documented infant death involving one of the rarest, most medically severe conditions a newborn can be born with, and a public record that, as of right now, contains no confirmed answer to the single most basic accountability question this thread of the case raises. Did anyone, at any point across those 4 hospital visits, formally flag concern for the other children this family already had at home? The investigation into the broader case remains active. All 4 defendants, Gary Siders Sr., Christina Siders, Gary Siders Jr., and Elizabeth Siders, have pleaded not guilty to the 16 counts of felony child endangerment each of them faces, and all 4 remain legally presumed innocent unless and until a court determines otherwise. That includes Elizabeth, the mother at the center of this specific hospital thread, a woman whose own medical history, when you actually lay it out chronologically like this, tells its own separate story, one that exists alongside, not necessarily in contradiction to, whatever the criminal case eventually determines about her legal responsibility for what investigators found in that house in June. The 16 children removed from that home are, as of the most recent public updates, in care and receiving support through Ohio's child welfare system. That process, by every account, is ongoing, and it's going to take time. The kind of time that doesn't fit neatly into a single news cycle or a single video like this one. I don't have a tidy resolution for you today, the same way I haven't had one in most of what I've covered about this case. What I have is a question, a specific, documented, on-the-record question that 3 different reporters put to 3 different institutions, a major hospital system, a county children's services agency, and the prosecutor now handling this case. And 3 answers that each, in their own way, declined to actually answer it. Did anyone report this? As of right now, nobody said yes. Nobody said no, either. And I think that particular silence, coming from 3 separate institutions, about a family that would go on to make national headlines 7 months after the last of those hospital visits, is exactly the kind of detail worth sitting with, even without a clean answer at the end of it. If you want to keep following this case as more of these threads get pulled, the ongoing competency evaluations, whatever comes next from the prosecutor's office, and any further reporting on what these hospital systems ultimately confirm or continue to decline to confirm, subscribe to this channel. We're going to keep asking the questions that haven't been fully answered yet, even when the honest answer, for now, is that we simply don't know.